Hello, everybody, and thank you for tuning in to the Liberty Report. With me today is Chris Rossini, our co-host. Chris, welcome to the program.
Good morning. Great to be with you, Dr. Paul.
Very good. You know, yesterday there was an article on Zero Hedge that we found attention-getting. It was describing the fact that it cost $1 trillion for medical care, and I thought, well, is that the whole thing? No, that's just the waste in Medicare, the waste into spending the money the wrong way. And of course, the progressives will say, see what happens when you have capitalism? This is what happens. You have all this waste, which is a farce because this is caused by government. And guess which party is responsible? It's that bipartisan group that does it. You know, no matter Republican or Democrats over the last 3 decades have always endorsed more government medicine. I remember one vote when I was in Washington late at night. The vote went on about 4 or 5 hours, and it was to pass a prescription health plan, expanding the services, and it was by the Republicans, and they were twisting arms. And they finally got it passed, and of course it's just added a burden of complications, but it was also a payoff to the drug companies. So the drug companies, the system we have today is a special interest medicine, and it's very expensive, and part of it kowtows to the special interest. And lo and behold, prices go up, and there's shortages and more bureaucracy. You know, when I read this article, Chris, I think the biggest emphasis they made was just dealing with the bureaucracy. And medical professionals now, I think there was one statistic that doctors on the average spend more time on paperwork than they do talking to patients. And I don't know if anybody ever paid any attention, if they have any private insurance, what the private insurance are required to send back to you. You know, 16 pages, and they say, well, you don't owe anything, but they've already paid for $50. And the paperwork is astounding. Doctors can't do anything in the office without putting it in the computer, and that computer goes to the U.S. government. So they know what medicines you take. They work with the drug industry. It's a real tragedy, and it's coming to an end because we can't afford this expense. And guess what's happening now? That the socialists, the progressives, are latching onto this, and we'll talk a little bit about this, Chris, is the tremendous expense of what it would be like if they have their way, how much more money they're going to spend, and of course, it's not going to do any good at all.
Right, Dr. Paul. And I have a family member who's an anesthesiologist, and he told me flat out, he says, most of his work is this bureaucratic government stuff. And he's an anesthesiologist. So it's the truth. And, the very first and biggest mistake that a person can make is to think that this is free markets or capitalism. It's not even close. Government got involved in healthcare many, many years ago, and it's been a disaster ever since. We have all these alphabet agencies. We have the FDA in this case, and it's really all these agencies. They are like little islands for the big corporations. That's how they get their subsidies, their monopoly privileges, and they create moats around their business, and they're secure, and they live great lives as a result of it at our expense. Now, it's not going to be sold to the public that way. We're supposed to think these are good things. People think that they can't live without the FDA. What would happen? Anarchy. But it's the exact opposite. That it's a big scam, and the costs of this are going through the roof.
That's for sure. You know, there's an old saying that everybody's familiar with, is that this country endorses the principle of the separation of church and state, which is a good principle. I'm not sure they really follow this, because that is a mixed bag when it comes to the First Amendment and how they enforce that. But I think there should be another slogan, and that is the separation of medicine and the state. Mm-hmm. And why shouldn't it be separate? Why should the government be running medicine? And there are still a few things left in our society that still, although everything is mismanaged and it's affected by the Fed and interest rates and all this, it's not pure free markets. But there's some places where there's a lot less and technology takes over. So what if we had the government totally responsible for the distribution of computers and electronics and cell phones? Can you imagine what it would have been like? And instead, the quality goes up, and the prices go down, and yet nobody recognizes this fact. The one thing I've noticed in medicine, as technology came along, and it changed dramatically. I finished my OB residency in 1968, and there was a lot of new stuff coming out in obstetrics and gynecology electronically. And that, never lowered the prices. Most of the time when electronic devices become available to a businessman, prices go down. But because of regulations in medicine, they've been regulated for a long time. You just don't go out and start a hospital without permission. And the medical profession is very protective, and they are monopolized, and they've been that way for a long time. So this is something that has been known, and it gets much worse because every time there's a absolute problem, they say, well, what we need to do is spend more money. Now, the socialists aren't going to win this fight. I mean, it's so absurd that if the Sanders-Warren, position works out, they'd have to immediately raise taxes. Over a period of time, over 10 years, and they admit to $34 trillion, but then they'd have to raise a lot more than that. Nobody knows what it would cost, but it's not a big argument that it could be over $40 trillion in 10 years. Well, one thing we don't have to worry about, that won't happen because we're broke and there's no way to do it. But, lo and behold, inflation and the Fed help create this problem by creating so much credit, and a lot of this medical stuff is malinvestment, putting in money in the wrong places. So right now, even the socialists have the answer: modern monetary theory, which is not modern at all. We just have to really, really get after the Fed to print money much, much faster, and it'll take care of everything. So the absurdity is out there, and there's a little bit of recognition. It's not going to happen, but I think there's going to be a need to have access to medicine in a private market in spite of what the conditions are like. And Chris, one thing I find really interesting, in spite of all this mess, and all the complaining about the doctors and the patients and how terrible it is and how expensive it is, there are still pockets of free market medicine popping up. It's interesting to see that there was one exemption, for medical insurance from even in Obamacare, that if you were a collective group, a Christian group or an Amish group or something like this, you could be exempt from some of those regulations. They were allowed to have their freedom. And there's some clinics now that have been developed in the free market. The one that I have the greatest admiration for is Keith Smick up in Oklahoma City. He has a free market clinic, but he doesn't take any insurance or any money. And guess what? The prices for his surgery is equivalent essentially to the down payment. The payment you just pay at the beginning. So it's economically very sound, and it's fast and efficient and all these things. So it does exist. This has been my argument, that we can survive if we don't totally destroy the market. Like in education, we want to be able to have private education and homeschooling. And we have to be able to do that and get out. I like competition and money. That, of course, needs to be watched. But if you have these exemptions where some people can opt out, I think somebody will find a way. But it'll be a contest. It'll continue to be a contest because government does not like competition. They want to silence people who are able to get around the government. But the numbers aren't there. They can't raise taxes. And this whole notion, not only do they expect modern monetary theory will work, just printing the money, but what about the wealth tax? That's about as insane as you can get. What if they took the top 5%? And that's a lot of money, there's no doubt about it, partially caused by the Federal Reserve. But what if they took all that money away and said, all right, you got to send 90% of your wealth to the government? Can you imagine? What if they had to sell all their stocks and bonds, in order to pay their taxes if they were going to confiscate it? The idea is just really crazy, and it's so anti-liberty, it's so anti-market, and they refuse to stop and think about what a free market is really like and right now it's hanging in there. And I think there's a lot of more people joining us in the study of free markets, especially groups like the Mises Institute's been doing it for years. So it's alive and well, but you just don't hear about it in Washington, and you don't hear about it on TV. But there's going to be a real opportunity because what we have to do is present the case that when the market works and get the government out of the way, like I suggest, the market worked essentially for cell phones. Prices go down, quality goes up, and even the poorest person, has a cell phone. Automobiles are basically the same way. Poor people end up with cars and cell phones. But medical care, no, they can't do it. I've argued for years that I was just in medicine a couple years before Medicare and Medicaid. And I worked in a Catholic hospital and in the emergency room, and everybody was taken care of. And everybody was charged the least. And that's the way the doctors used to operate. You'll probably could read doctors who practiced medicine way back. They took into consideration what the patient could do. They charged the least. Today, because of the system, everybody has to be charged the maximum because somebody's going to cut away at it, and you'll get less. So, matter of fact, unfortunately, even the doctors have difficulty because they're forced into these groups, and they really don't have this control. If they see their friend and come in, oh, I don't want to charge you today. Well, the companies that run these programs, they don't like that. They want to maximize it. So it's exactly opposite of what the market would do. So these people who say this is a result of capitalism and free markets, that's why poor people can't get medical care, that's a bunch of baloney, and they ought to really understand that this comes from too much government, and that's why we have the problems that we're facing today in medicine.
It is baloney, Dr. Paul, and another piece of baloney that we hear all the time, especially from the left, is the businessman is greedy, and we need politicians to curb them. As if politicians are not greedy, as if are they not human beings? And can anybody look at the political scene and think that politicians are not greedy? Honestly, it's completely backwards, because anybody can make the decision, and we make it all the time. There's a restaurant that I don't like in my town, and I don't ever have to go there ever again, and I won't. And there is nothing that businessman can do. He can't take 1 penny from me. I can't say the same thing for politicians. No matter what I do, they're taking here. Every move I make, their hand is in our pockets, and you can't get rid of it. I could go to a different state, and they'll take there too. So, and they take up to like $4 trillion a year from Americans just in our country. They rack up $22 trillion in debt on top of it. They make promises, unfunded liabilities of over $100 trillion, and we're supposed to expect that these are not greedy people, that the businessman, where we have some control to say, no, I will never deal with you again, that they're the greedy ones. It's completely backwards.
Yeah, I think that's a great point, because if we earn our own money and we want to spend it, we're greedy. But if they steal it from it, and that's stealing, the politicians steal it and they pass it out, oh, that's humanitarianism. Yeah, that is a great point. I wanted to talk for a minute about the insurance that is available even under these conditions. They're not readily available, but I believe that Trump has lightened up with Rand's help on this to lighten up and allow more of these people to compete. And these are the insurance companies that band together, and it's not really insurance. What they do is they bargain. And Keith Smith lists all these prices, which should be done, and there should be negotiation. But these companies, and there are some Christian groups, or some large Christian groups, and they're advertising on TV all the time, and it's sort of like what the Amish would do, is it's a voluntary group. You pay a fee every month, and you deal with the hospital separately as individuals. And hospitals do respond once they know about it, that you deal with them. And they will lower their prices. But what if it's more than what their token payment to the group is? Well, everybody gets sort of an assessment, and it has worked. It's a voluntary group a group approach to this. And of course, the more like the people are, the more likely they are that they will participate in this. But they do exist, and they can exist, and the market would solve problems like that, because medicine is very expensive. But once again, I want to emphasize, if we had free market medicine, prices would go down. They would be forced to go down because there would be more competition. The licensing process is just horrible. You know, I remember when the radical liberals said, well, we have to regulate the laboratories that the doctors run because they might not take good care of their patient. So they set up all this nationalization of our small little laboratories in our office, and we had to fill out forms and do all these things to satisfy the federal government. But the people behind that were the big laboratories. So they prevented the smaller doctors' offices from doing it, and then the big companies would come in, and they were ready the next day after the law went into effect. Okay, we'll pick up your stuff and we'll do it. And the prices went up. It was more cumbersome. There was more delay, and the things that I could do at the office, you know, I could do a fair number of tests, but the companies frowned on it, and I always forgot to fill out all those forms and things. So I stuck around and provided these services, but I could do it for 10% of what those big companies were doing, and I could have the results immediately. The technology made it easy for us to do what used to be very complicated tests, and that is even getting better. So, but they need competition. If you want to build a clinic today and say move in the direction of say Keith Smith and have your own clinic, believe me, you run into regulations. The medical profession doesn't want competition. The hospitals don't want it, and they're dependent on government payments. It's a mess. You need to legalize competition is what you need. But and licensing does not limit that. And people say, what? You wouldn't have to have a license? Wouldn't they be regulated? Yeah. How do most people pick their doctor? They ask their neighbor, who do you see? Who do you like? And the regulations of licensing are, but you could say, well, I want to see only a doctor that has a license. It could and has worked. But this whole idea that you can restrict laboratories and drug companies, and you have the insurance company, it's so bureaucratic. That's why we're spending $1 trillion a year right now on non-medical care, and the solutions being offered in Washington right now. Oh, okay, we'll tax more and regulate more, and we'll destroy rich people, and we'll establish the principle that it's morally wrong to work and be rich. So I think that needs a real challenge to those principles, and I believe that the free market can fulfill those requirements.
All right, Dr. Paul, I'll finish by quoting the great Frederick Bastiat, who said that the state is the great fictitious entity by which everyone seeks to live at the expense of everyone else. And boy, do we see that in healthcare. There will never be a political solution, ever, whether it's Obamacare, Trump care, or any other politician care. Crony businessmen, they like this because they get to be artificially rich using government force to secure their business. Politicians like getting involved because they have this mental deficiency that they want to control people. And then you have the people themselves who are walking around trying to convince themselves that they have a right to health care. I can't imagine going into my doctor's office and saying, Doc, let's get started. I have a right to every single thing you're going to do here today. He would probably laugh in my face. We have to get back to reality. The solution is to get government out, get all these distortions out, and deal with each other like human beings.
You know, I think that's a good point, and of course it's the riskiest political position you can have is to tell people you don't have a right to demand medicine for free, is what they're saying. And that doesn't mean that they wouldn't be provided. Matter of fact, this system where the right is there and then you get the government involved, what does it do? What does it breed? All these special interest groups. So it doesn't work. But the principle is wrong. You don't have a right to somebody else's life. I like to think that you can't make some people rich. You can't make some people rich by making other people poor. And that's what they believe that they can do. We'll take the money from this group, put it over here, and everybody will be rich. No, they'll be more equal. they will be more equally poor, and only the very, very super rich then might be able to afford it because there will be such a calamity. Do you think the people that ran the healthcare system in the Soviet Union and in China, do you think they wait in line, to have their teeth fixed or see a doctor? No. In all those societies, the people who run the government end up with it. That's why you don't want the government to run it. You want the people to run it. The people vote on the doctors by deciding whether it's a good doctor or not, and making sure the doctor's well trained. It will work. And they say, well, no, we need regulation to protect the consumer. No, that's what's been happening. After 20 or 30 years, the two parties have been protecting the consumer and protecting everybody to guarantee good health care, and this is where we are today. We're going broke. And $1 trillion, I mean, that's just chicken feed now, but next year it's going to be a lot more. And it can't be afforded, and these schemes of higher taxation and printing more money and more regulation, it's totally insanity. It doesn't work. Why people just keep pursuing this, and they're motivated by the humanitarians. The socialists are humanitarians, but the people who believe in liberty, no, you're selfish. And yet, when you look at the results, you find out that the free market and a system based on individual liberty, that is where the peace and prosperity comes from. I want to thank everybody for tuning in today to the Liberty Report. Please come back soon.